Hello ladies, and welcome to episode 2 of Mama Moves, my postnatal Pilates series. Today it's all about the core and pelvic floor. Today we're in our outdoor location and we'll be discussing some of the most common issues that occur in the postnatal period. These include issues like diastasis recti, incontinence, leaking, and prolapse, and today we're going to be discussing the top 2 most common issues. So what is diastasis recti? You may have heard this or it has happened to somebody else that you know, but it is basically a separation of our rectus abdominis muscle which runs down the length of our abdomen. It's a separation that occurs due to the weight of the pregnancy that pushes or bulges outwards. This phenomena actually happens in 100% of pregnancies, so don't think that you did anything wrong, but let's start to see how we can fix it. Firstly, we need to learn how to breathe right. As discussed in the first episode of our Mama Moves series, we have to learn how to breathe fully and deeply. So like we discussed earlier, hands on your ribcage, we're going to inhale through the nose, expand laterally into the lungs, and exhale through the mouth as we lift our pelvic floor and wrap our abs around our waist. This should be the very first thing you start off when you're in your postnatal period. So for the first 4 weeks, let's religiously practice this breath. We try to avoid exercises like crunches or sit-ups that causes pressure in the abdominal area. What we want is to avoid any bulging or coning through the abdominal gap. Instead, focus on exercises that work on your deep core strengthening, like hovers. You want to engage your core as you lift, so exhale, brace yourself, and inhale to relax. You can progress this exercise by adding a single leg extension and the same thing, exhaling to engage and lift. Another great exercises are dead bugs. Super simple, arms overhead, legs in tabletop, reaching the alternate limbs away from your body and keep switching sides. This is a great way to strengthen those deep abdominal muscles like the transverse abdominis. The second issue we'll be discussing today is known as incontinence. This is basically the inability to control your urination, and it happens very commonly after your delivery process because of a weak pelvic floor. There's a lot of shame associated with issues like this, so first of all, be kind to yourself and understand that it's okay that these things are happening in your postnatal period. Learning how to engage your pelvic floor is the best thing you can do for such issues. So let's learn how to do a Kegel. You may have heard the name of this exercise but may not know how to properly perform it. Contrary to popular belief, Kegels are not just meant to hold or suck in, because that way we end up using our glutes and inner thigh muscles way too much, and that's not actually helping us engage our pelvic floor. So let's try to visualize what our pelvic floor muscles look like and look at the sphincters in our pelvic floor. Then this will help you kind of get into the feeling of what you're supposed to engage. So try this out. Maybe lie down on your back. This is an easy way to get into doing this exercise. Completely relax your pelvic floor as you inhale and let everything out. And as you exhale, imagine as if you're grasping something from your sphincter in your pelvic floor. And grip that and hold that inside your pelvis. You don't want to use your glutes, you don't want to use your thighs, just the pelvic floor itself. Try to hold that for a count of 1, 2, 3, and then release for a count of 1, 2, and 3. When you're comfortable with performing Kegels in their basic form, you may want to progress them by adding a level up or an elevator method. What that does is basically help you to keep that contraction for a longer period of time. So again, inhale and relax. And as you exhale, not just hold in your pelvis, but try to lift the elevator up through your abdomen and hold it higher in your abdomen. What you can then try is to combine movements with this pelvic floor activation. A great exercise to do that is your pelvic bridge. So arms down by your side, use that activation by exhaling to hold in and then lift the hips up towards the sky. This way you're going to engage more than just your glutes and your inner thigh muscles, but actually work on the pelvic floor muscles themselves. Even though these exercises are super simple, they're highly effective. So try to practice them as much as you can to prevent such issues like we discussed today. So subscribe to Aimfit's YouTube channel so you can stay up to date with our upcoming